With that, I'd like to turn this session over to our sponsor for opening remarks. We are pleased to have with us Steve Rollins, Deputy Associate Commissioner, Office of Disability Policy of the Social Security Administration, and Vincent Nibali, Policy Analyst, Office of Medical Policy, Office of Disability Policy, Social Security Administration, who will give an overview of the disability program.
Okay, thank you, Sarah. As indicated, my name is Steve Rollins, and I'm the Deputy Associate Commissioner of the Social Security Administration's Office of Disability Policy. Certainly a pleasure to join you all here today for this dive into the world of hematopoietic stem cell treatment. On the Social Security side, I know our team is looking forward to today's discussions, and we really are excited to hear and have the opportunity to learn about how we may be able to refine how we evaluate individuals that have undergone or may qualify for stem cell based treatments. We asked the National Academies to host today's workshop, in part due to the complexity of the topic. But also because of the tension we've seen in the press on stem cell treatments. We typically see the tension between it being a revolutionary potential that these treatments can what they can do versus the iterative reality of medical care and what happens every day. So we've seen a number of articles outlining how new stem cell discoveries could mean the end of some debilitating impairments. And we really need to understand the reality of how these hopes may translate into medical and functional changes for individuals, especially as it relates to the programs that we administer. And that's why we are excited about the agenda today, because we get to hear from the renowned experts about the current landscape of hematopoietic stem cell treatment and how the recipients of the treatment recover over time, as well as the late effects that they continue to deal with and how those effects are measured and treated. So, we think all this will help keep us and our adjudicators in particular well informed and prepared as they evaluate cases involving stem cell treatment. We expect the last session of the day, the future outlook of stem cell treatment and disability, that really will help further guide our efforts in this area as we move forward. So before I end, I just do want to thank and offer the Social Security Administration sincere thanks to all the moderators and presenters and experts for taking time out of what I'm sure is your very busy schedules to share your insights with us. We certainly rely on you to keep us at the forefront of the changing medical landscapes and practices, so the public can count on us to make fair and accurate disability determinations. So with that, I'd like to turn things over to Vince Nibali. He's one of our policy analysts, and he'll give you a brief overview of how the disability programs we administer function and how we evaluate whether a person meets our standards in order to be considered disabled. So Vince, it's all you. Thank you.
Thank you very much, Steve. So for all of our participants and attendees today who may not be intimately familiar with them, I'd like to talk through an introduction to SSA's disability programs and how we make disability decisions. First, I should note SSA administers two different programs actually that provide benefits on the basis of disability. The Social Security Disability Insurance, or SSDI program, and the Supplemental Security Income, or SSI program. While these two programs have different non-medical requirements for eligibility, essentially how long you've been working or versus the resources you have, the important thing to keep in mind today is that both programs share the same medical criteria and go through the same sequential evaluation processes, one for adults and one for children, to determine initial eligibility. So for adults, disability is defined by statute as the inability to engage in substantial gainful activity by reason of a medically determinable physical or mental impairment, or combination of impairments, which is expected to last for a continuous period of not less than 12 months or result in death. For children, a finding of disability is based upon having what we define as marked and severe functional limitations. So for both adults and children, the outcome of a disability evaluation depends upon the severity of functional limitations arising from the person's impairment or combination of impairments, either because those functional limitations preclude work or because they are marked and severe. Now, I mentioned that SSA uses sequential evaluation processes to determine eligibility. There's one sequential evaluation process for adult claims and one for child claims. But I'd like to describe those just a little bit more. As the name implies, these processes have us working in order through specific questions to determine whether a person meets our definition of disability. These questions are designed to allow our adjudicators to decide the clearest cases the most quickly. So for example, in both the adult and child processes, the first question we ask is whether the individual is currently working, or in our parlance, engaging in substantial gainful activity. Generally, if a person is working, we can't find that they're unable to work. But another important thing to note about both the adult and child processes is that they contain what we consider a screen-in step, where we compare a person's findings against the criteria in our listing of impairments. The listings, as we call them, actually represent impairments that meet a higher standard of limitation than we require for disability in general. So they're designed to capture the most severe and obvious cases of disability. But keep in mind, no claimant is ever denied for failing to meet the requirements of our listings. Because this is a screen-in step, instead, we would move on in the sequential evaluation process to a more in-depth functional or occasional analysis. We currently have listings in several body systems for impairments treated with stem cells, including hematological disorders, cancers, and immune deficiency disorders. These listings currently prescribe that we find the recipient disabled for at least 12 months after the date of transplantation or treatment. Determining if we can add new listing criteria for stem cell treatments or if we should tweak our existing rules are areas we look forward to today's discussions elucidating. Finally, on the other end of our disability program, SSA has a statutory responsibility to timely and accurately identify those individuals currently on our rolls who no longer meet our requirements for disability. In order to capture that group, SSA regularly conducts continuing disability reviews, or CDRs, in all of our cases. However, the frequency with which we conduct a CDR for an individual is based in part on how likely we consider their underlying impairments are to medically improve over time and over what time frame that improvement might occur. So this is another area we trust the information presented today will assist us in reviewing. To sum up the basics of our disability evaluation processes, we have sequential processes we follow to determine if adults or children meet our standards for disability. For adults, that standard is an inability to engage in substantial gainful activity. For children, the standard is marked and severe functional limitations. Both sequential evaluation processes have a screen-in step where we consider whether an applicant meets the criteria of our listings, and all of our disability recipients undergo continuing disability reviews, but the frequency with which they undergo them depends upon their underlying medical conditions and what we know about the likelihood of improvement. There are obviously many other complexities and nuances to SSA's disability determination processes, but I hope this brief overview has provided some insight into how information on stem cell treatment and disability can contribute to our agency's mission to provide the most accurate disability decisions as efficiently as possible. Thank you very much.